Hi, I'm Dr. Miles Ashley.
I'm Dr. Sam Ashley.
Welcome back to our monthly eye topic video. Today's topic is going to be on dry eye, which is going to be a series over the next 2 or 3 months that we're going to do. Dry eye is basically a condition where the eye has an unstable tear film that fails to protect the surface of the eye, and this leads to the eye surface becoming damaged and inflamed. And the reason that the tear film can become unstable is due to the tear glands in the eye not producing enough of the watery layer of the tears, or the oil glands in the eyelids not producing enough oil, or a poor quality oil that leads to the tear film evaporating too quickly in between blinks. Some of the common symptoms of dry eye include redness, burning, foreign body sensation, and blurry vision that comes and goes. Right now, Dr. Sam Ashley is going to go over some of the signs that we look for in the clinic when people present with these symptoms.
This is an example of a patient that enters with the chief complaint of the eyes being red, burny, scratchy, and irritated. We want to look to determine what would be the cause of this particular irritation of the eye and some of the testing that we can do for a dry eye. This in particular is a case where we've introduced fluorescein into the eye in a fluorescein strip and are looking at the eye with a blue light. This is called the tear film meniscus, which is the lower part of the tear film and where it pools along the eyelid margin before it goes into the lash margin. This is a particular case where that tear film meniscus is decreased, and in the case of a dry eye, you'll see a thinner meniscus layer in this case. Also, as far as looking at the tear film itself, this is actually a case where we've instilled tear film again, fluorescein into the tear film, and are looking at it with a blue light. What can happen in an irregular tear film, you'll have surface irritations that pool, and fluorescein will fill up these little irritations. They're like little scratches on the eye, and this is a condition called superficial punctate keratitis, which can vary in the degrees. Actually, some of the things that can cause the superficial punctate keratitis are maybe not getting a poor quality tear film, or some of the oil glands, which in this case shows you blocked meibomian glands, which are actually the oil glands just inside the lash margin. Each of these oil glands usually are responsible for producing the oily layer of the tear film. And this is the case in a microscopic condition to where you can actually see the substance that comes out of the oil glands, which is usually a clear, oily type meibum type substance. It can go from anywhere from clear to where they start beginning to get blocked up, like is in this case right here, where the glands are not doing a good oily layer, and you can start causing dryness, redness, irritation of the eye, and they can actually go to a point to where they actually totally occlude, and in this case they'll form a hardened yellowish type substance that can actually be expressed. Like this is someone that actually expressing the meibomian glands, which can sometimes help in conditions of dry eyes. Actually, with some of the oil glands that actually block up are what are responsible for maintaining the tear film to keep it from breaking up. Normally the eye would blink, and this surface of the tear film will stay there for a certain amount of time, and before it'll start breaking up and causing an evaporative type tear film. This is the case where the tear film is unstable, it breaks down, it can start causing blurred vision and the eye to be dry and irritated feeling. So certain parts of the oil glands are responsible for maintaining this position or the association between a good normal tear film and one that's breaking up like this.
Thank you for tuning in to this month's episode. Next month we're going to talk a little bit more about the causes of dry eye and also some of the treatments for it. Thank you.